My name is Betty.
And what did you come in for?
I came in from diabetic neuropathy, and it was bad. I was walking with a cane and wobbling all over.
Yeah.
And now I'm walking without the cane and straight.
Yeah.
My sores on my legs have, because of the good circulation I'm getting now, have healed up, and I'm able to write very well again. And
You notice improvement in your writing?
yeah, I was writing small and scratchy, and now I'm writing back to normal, and my mind has improved.
Memory?
Yeah, my memory has gotten much better. So I'm on the mend.
Yeah.
I'm feeling great about it.
Yeah, and awesome. Well, I'm so happy that, everything is getting better, and that's what you would say.
Oh, I am so thankful for this.
What did your daughter say? She hasn't seen you in a little while.
No, she hasn't seen me in about 6 months, and she said, "Oh, Mom, you're doing so well," And she was concerned about me, and she wanted to come home and check me out, and she was really pleased.
Very good.
So,
all right. Well, thank you for sharing.
Hi, this is Shirley Smith, and I'm a fairly new patient of Dr. Roberts, and I've been going here for approximately 5 weeks. I came here initially because I had so much pain in my feet from neuropathy because I'm diabetic, and I also had a major accident where I had a concussion, and so I was having a lot of headaches. Since coming here...
How long have you had the pain in the feet, and how severe was it?
The pain in my feet I've had for 15 years, and I would put it at a 10, similar to walking on glass or pointy rocks. And my feet issue has changed from now it's more of a burning, and it's down to maybe, on a scale of 1 to 10, a 4.
So from
and
a
so
10
I've seen great improvement.
Down to a 4. And how is the feet every night for the last 15 years affecting you? What would happen with...
So most nights I would wake up multiple times during the night from a sound sleep because of the pain in my feet, and it would just be a number 10 for several minutes, like a 30-minute issue, and then I'd be able to fall back asleep, but then I'd wake up again in a couple hours, and I had that for more than 15 years.
Yeah.
Now I wake up maybe once a week, and the pain, instead of being a 10, is again like a 4.
Wow.
So big improvement.
Yeah.
My concussion is changed from headaches 24 hours a day, 7 days a week, to 0. I have no headaches whatsoever. So that's 100% cured, I would say, or gone.
Yeah. And anything different about meals and eating and after eating?
I also had another problem with irritable bowel syndrome that was very significant. In fact, I was taking Imodium every other day. After 3 days of seeing Dr. Robert, I stopped the Imodium, and I've not taken one since. So I look at that as 100% change.
Yeah. Just amazing change, because that was for years.
Right.
Yeah. And very hampering.
Yeah.
Very hampering. So
overall, I feel much better, and my family keeps telling me how much better I look.
Well, thank you for sharing.
I'm Vivian Vedner. I'm from South Haven, and I've been coming to Dr. Young since the end of February. And he's working on my feet. I have neuropathy in my toes so bad that I can't stand anything to touch them. Socks, bedding, anything. And I also have rocks on the pads of my feet. It felt like walking on rocks, and Dr. Young worked on that, and it's all gone. I'm so excited. I just can't believe how it feels to walk normal. And also
so the feeling of rocks on your feet is gone.
Yeah, it's totally gone.
And the sensitivity and burning that you had?
That's gone. That is totally gone. So it's so marvelous just to be able to do that, because it was so hampering before that I didn't feel like doing anything. And like I told him before, my house has never been so clean. I've been energy, and being able to walk on my feet, I just am so blessed that I came here.
So how many weeks has it been since starting care?
I think it was February 26th, maybe was my first
It's about 4 to 6
appointment.
weeks. Would you say about?
Let's see, March, 5 weeks.
5
Pretty
weeks.
Close to 5-6 weeks now.
Yeah.
Yeah.
So that's just really amazing because you've been dealing with this for how many?
Oh, quite a few years. At
Yeah.
least 8 years.
At least 8 years.
Yes.
Yeah. So, well, any piece of advice for anyone who's been having
Well,
burning in the
yeah.
feet, pain in
If
the
anybody
feet?
has trouble with your feet, please go see Dr. Young, because he would definitely cure them for you.
All
My
right.
name is Connie,
What
and
brought
I
you in?
came to see the doctor for mainly neuropathy
Mm-hmm.
and diabetic issues. My feet have been getting progressively more numb over the years, couple of years, and I sort of ignored it. My endocrinologist didn't deal with it, couldn't deal with it, so I was afraid it was going to go up my leg, and I didn't want to lose my leg.
Mm-hmm.
So now my blood sugars are kind of evening out. I was 97 this morning, which
Yeah.
is hallelujah.
Hallelujah. Because before starting, the regular in the morning would be what? What numbers?
Could be 200, could be 150.
Yeah.
Could be a low because I had a low during the night and didn't know it, so it could fluctuate.
It's all over the
greatly.
place. And have you noticed that stabilize?
More so.
More so, yeah.
More stable.
Yep. And how about your feet? What have you noticed different now that we've worked here with neuropathy in your feet? What are you noticing? What improvements have you noticed?
I can feel texture. I can feel temperature. And like I told you, I could feel that little kernel of something on a rug, and it could have been embedded in
Mhm.
it. But there was like a little something or t'other.
But that's
was
been
falling.
a couple of years at least that you've had any of that feeling.
Correct.
That's correct. Okay. Well, that's amazing because it's been just a few short weeks.
Well, a couple months, I think, isn't it?
Mm-mm.
No?
No, about 5 weeks.
5 weeks?
Yeah.
How time?
Very good. All right, but anyway, that's amazing because you've had this for a really long time,
Mhm.
right? So, well, thanks for sharing.
You're welcome.
Go ahead and introduce yourself.
I'm Lowell, and I've come here for about 2 weeks now, and I used to have night sweats.
For how
And,
long did you have night sweats?
About 11 years.
11 years.
It was very interrupting your sleep. And
Yep.
since then, I haven't had any more night sweats.
Since starting
Correct.
care. Yep.
Correct.
So that's a pretty big deal.
Yeah, absolutely. And my diabetes numbers, which I've had diabetes
Since what year?
94.
Mm-hmm.
And my numbers were pretty much 170, 180, 185, so forth. Now they've been down to 135, 129, 106, 115.
How low has it gone now?
106, I think, was the lowest. I haven't gone below 100, but still.
Yeah, but it's been two weeks.
Yes.
Right, not even 2 weeks actually.
Right.
So that's a giant change in a very short amount of time.
Absolutely, absolutely. I mean, it was just mind-boggling because you struggle at my age. You think it's your age, but then
Do you mind sharing how old you are?
82 in October.
Yeah. So
And-
it's
and-
able to change. Even at 82 years old, you're able to go from 170s, 190s of blood sugar down to
Oh, yeah,
104,
And
105.
I'm sure those high blood sugars contribute to my 8 stents in my heart,
Mm-hmm.
and I know that they're intertwined.
Yeah.
And so hopefully now that the blood sugar's getting towards normal,
Yeah.
maybe I'll hit that.
Yeah. And,
And,
you've been trying you said, for years.
Oh yeah,
like actually
by
really trying.
myself. I've been always heavy on the homeopathic versus medical community because all they do is band-aid things most of the time,
Mm-hmm.
and it's been great.
Okay. Well, thank you for sharing.
Well,